Imagine a world without antibiotics, without anesthesia, without the sterile, white-walled hospitals we know today. It's easy to dismiss ancient medicine as a collection of superstitions and bizarre rituals. But what if I told you that hidden within those ancient practices were secrets so effective, they form the very foundation of modern medicine? For thousands of years, healers across civilizations, from the banks of the Nile to the mountains of China, developed treatments that weren't just based on guesswork. They worked. And today, science is finally proving just how brilliant our ancestors really were. Join us as we uncover 20 ancient medical practices that actually worked. Our journey begins in ancient Egypt, over 4,000 years ago. Picture a physician treating a deep wound, not with a modern antiseptic, but with a thick golden substance, honey. Egyptian medical texts, like the famous Edwin Smith Papyrus, detail how healers would pack wounds with raw honey. To them, it was a divine gift that prevented infection and promoted healing. And they were absolutely right. Modern science has confirmed that raw honey is a powerhouse of antibacterial properties. It naturally produces hydrogen peroxide, a well-known disinfectant. But beyond that, it contains enzymes and a low pH that create an environment hostile to harmful bacteria like staph and E. coli. It draws moisture out of the wound, dehydrating bacteria and speeding up the healing process. Honey wasn't just a sweet treat. It was Egypt's ancient antibiotic miracle. Now, let's travel east to ancient China, around 2,500 years ago. Here, healers viewed the body not as a collection of individual parts, but as an interconnected system of energy, or qi, flowing through pathways called meridians. When this flow was blocked, pain and illness would arise. Their solution? A practice we now know as acupuncture. By inserting hair-thin needles into specific points on the body, they believed they could restore the flow of qi and alleviate suffering. For centuries, Western medicine was skeptical. But today, numerous controlled studies have shown that acupuncture is far more than a placebo. It stimulates nerves, muscles, and connective tissue, prompting the body to release its natural painkillers endorphins. It has been proven effective for chronic pain, migraines, and even nausea. The ancient Chinese mapped a system of healing long before our science could explain it. Long before aspirin was a household name, ancient healers knew where to find relief from pain and fever. In ancient Greece and Samaria, people suffering from aches would be prescribed a simple remedy: chew on the bark of the willow tree. The taste was bitter, but the effect was remarkable. What they were unknowingly consuming was salicin, a powerful anti-inflammatory and pain-relieving compound. In the 19th century, scientists isolated this chemical and synthesized it into acetylsalicylic acid, the active ingredient in the aspirin we use today. Hippocrates, the father of medicine, documented the use of willow bark, providing a direct lineage from an ancient herbal remedy to one of the most widely used drugs in the world. Back in Egypt, pyramid builders weren't just fueled by bread and beer. Their diet included a crucial ingredient for their health: garlic. The Ebers Papyrus, one of the oldest medical documents in existence, lists over 20 remedies involving garlic, prescribing it for everything from circulatory problems to infections and parasites. The ancient Egyptians believed it imbued them with strength and protected them from disease. Science now shows us that garlic contains a powerful compound called allicin, which is released when the clove is crushed or chopped. Allicin is a potent antimicrobial agent, effective against bacteria, fungi, and viruses. Modern studies continue to explore garlic's benefits for heart health and the immune system, validating the wisdom of the pharaohs. In ancient India, the holistic system of Ayurveda viewed health as a balance between mind, body, and spirit. When faced with inflammation, whether from an injury or an internal ailment, Ayurvedic practitioners would turn to a vibrant, golden spice: turmeric. They would create a paste from the root and apply it topically to reduce swelling, or consume it to treat internal inflammation. For millennia, this was a cornerstone of their pharmacy. Today, turmeric is a global health sensation, and for good reason. Its active compound, curcumin, is a powerful anti-inflammatory that has been the subject of thousands of scientific studies. Research suggests it can rival the effectiveness of some anti-inflammatory drugs, but without the side effects, proving that Ayurvedic healers had identified a true natural wonder. Let's imagine the chaos of a Roman battlefield. A legionary is struck, and blood is flowing freely from a limb. A Roman medic, a medicus, rushes in. He doesn't have modern medical gear, but he has a strip of cloth and a stick. He wraps the cloth tightly above the wound and uses the stick to twist it, applying immense pressure until the bleeding stops. This was the ancient tourniquet. It was a brutal but life-saving technique, the same fundamental principle used in emergency medicine today. By cutting off blood flow to a limb, Roman medics could prevent a soldier from bleeding to death, giving them time to treat the wound. It was a simple, desperate, and brilliantly effective solution. Now for a remedy that sounds counterintuitive, applying moldy bread to a wound. While it might seem unsanitary, ancient Egyptians, Greeks, and even Serbian peasants practiced this. They had noticed, through trial and error, that some molds seemed to prevent infections from festering. They were, completely by accident, harnessing the power of antibiotics. They didn't know about penicillin or the specific fungi, like Penicillium chrysogenum that produce it. But by applying moldy bread, they were introducing these antibiotic-producing organisms directly to the source of infection. It was a precursor to Alexander Fleming's famous discovery, a testament to the power of folk observation. The skill of ancient surgeons is often underestimated. In Egypt, they performed procedures that seem astonishing for their time. Archaeologists have unearthed delicate, specialized bronze instruments, tiny scalpels, probes, and hooks that were used for eye surgery. Inscriptions and papyri describe operations to remove cataracts, the clouding of the eye's lens. This required incredible precision, a steady hand, and a deep understanding of anatomy. The fact that they even attempted such a delicate microsurgery thousands of years ago and developed tools specifically for it shows a level of medical sophistication that is truly mind-blowing. Let's return to traditional Chinese medicine. Alongside acupuncture, another common therapy was cupping. Practitioners would place glass or bamboo cups on the skin and create a vacuum, either by heating the cup or using a pump. The suction would pull the skin upward, drawing blood to the area. It was used to treat muscle pain, improve circulation, and clear respiratory congestion. You might have seen the circular marks it leaves on modern athletes. Once dismissed as pseudoscience, studies now suggest cupping can indeed reduce pain and inflammation by promoting blood flow and stretching connective tissue. It's another ancient practice that has found its place in the modern wellness world. In ancient Greece, people on the island of Chios had a unique solution for indigestion and oral hygiene. They would chew on the resin, or tears, of the mastic tree. This gum had a fresh pine-like flavor and was known to soothe stomach aches and freshen breath. The physician Dioscorides wrote about its healing properties nearly 2,000 years ago. Today, mastic gum is making a comeback. Scientific research has shown it possesses antibacterial properties, particularly against Helicobacter pylori the bacteria responsible for most stomach ulcers. It works by reducing inflammation in the digestive tract, confirming the wisdom of the ancient Greeks. In Ayurvedic tradition, the morning routine often included a practice called oil pulling. This involved swishing a tablespoon of sesame or coconut oil in the mouth for 15 to 20 minutes before spitting it out. The belief was that this action would pull toxins from the body, improving not just oral health but overall wellness. It may sound strange, but modern dentistry has taken a closer look. Studies have confirmed that oil pulling can significantly reduce the amount of harmful bacteria in the mouth, such as Streptococcus mutans a primary cause of cavities. It also helps reduce plaque and gingivitis, validating this ancient Indian method for maintaining excellent oral hygiene. We often take sterile bandages for granted, but their origins go back to ancient Egypt. When mummifying the dead, Egyptians used long strips of linen. But this material wasn't just for funerary rites. It was also used to dress the wounds of the living. The key was in their preparation. They would often boil the linen or treat it with antimicrobial agents like honey or resins. This process of sterilization made the linen strips incredibly effective at protecting wounds from infection and absorbing fluids. They were, in essence, the world's first medical-grade bandages, a simple but revolutionary step in wound care. Surgery without anesthesia is a terrifying thought, but ancient surgeons weren't always operating on fully conscious patients. In ancient Greece and Rome, healers like Hippocrates and Dioscorides were master herbalists. They created concoctions from plants like the mandrake root, henbane, and opium poppies. These were powerful narcotics and sedatives. They would administer diluted mixtures of these herbs to patients before surgery, inducing a state of drowsiness or unconsciousness. It was a risky art, as the dosage had to be just right. But it was the earliest form of anesthesia, a merciful innovation that allowed for more complex procedures and demonstrated a deep knowledge of pharmacology. How do you get ice in the middle of a scorching Persian desert? The ancient Persians engineered a solution, the yakshal. These were brilliant. Ancient refrigerators, conical structures made of a special mortar that could store ice brought down from the mountains throughout the hot summer months. And this ice wasn't just for chilling drinks. Persian physicians, including the famous Avicenna, documented the use of ice and cold water to treat swelling and inflammation. By applying cold to an injury, they could numb pain and reduce blood flow, a practice we now call cryotherapy. Centuries before the invention of the freezer, they had mastered the art of therapeutic cold. For anyone who has ever used a neti pot for a stuffy nose, you are partaking in an ancient Ayurvedic practice. Known as yala neti, this technique involves pouring a lukewarm saline solution through one nostril and letting it drain out the other. The goal was to cleanse the nasal passages of mucus, dust, and allergens, promoting clear breathing and preventing sinus infections. It's the exact same principle behind the nasal irrigation kits sold in pharmacies today. It mechanically flushes out irritants and helps thin mucus, providing relief from colds and allergies, a simple, effective hygiene practice that has stood the test of time. Accidental poisoning was a serious threat in the ancient world. But Egyptian and Hindu texts describe a surprising antidote: charcoal. They knew that consuming powdered charcoal after ingesting certain toxins could save a person's life. They didn't understand the chemistry, but they observed the results. Today, we use a specially processed form called activated charcoal in emergency rooms for the very same reason. Activated charcoal has a porous surface that binds the toxins in the stomach, preventing them from being absorbed into the bloodstream. The body then flushes out the charcoal and the poison along with it. Imagine stepping into a warm, fragrant room filled with steam. This wasn't a modern spa. It was an Ayurvedic healing treatment in ancient India. Healers used herbal steam rooms, a practice known as swidana, to induce sweating. They would infuse the steam with specific herbs tailored to a patient's condition. The belief was that this would open up the body's channels, release toxins, and relax the muscles. Modern spa therapy mirrors this directly. Steam helps to improve circulation, open pores, and soothe the respiratory system. The addition of aromatic herbs, or aromatherapy, adds another layer of therapeutic benefit, just as the Ayurvedic masters intended. In the 17th century, European explorers in South America noticed that indigenous peoples of the Amazon had a powerful treatment for the fevers that ravaged the region. They would use the bark of a specific tree, the cinchona tree, to create a bitter drink that could break a raging fever. This knowledge was a closely guarded secret. Eventually, the bark made its way to Europe, where it was found to be a miraculous cure for malaria. Scientists later isolated the active compound, quinine. This became the world's first effective anti-malarial drug, saving millions of lives. And it was all thanks to the traditional knowledge of Amazonian healers. Vanity is not a modern invention. In ancient Rome, a perfect smile was as desirable as it is today. Archaeologists have unearthed remarkable examples of early dentistry that look surprisingly familiar. They found dentures crafted from bone and ivory, held in place with gold wires. More impressively, they discovered gold tooth caps or crowns fitted over damaged teeth. This wasn't just functional, it was cosmetic. These early dentists could restore not only a person's ability to chew, but also their appearance and confidence. It was a sophisticated craft, combining medical skill with artistry. From the honey-packed wounds of Egypt to the pain-relieving needles of China, from the willow bark chewed by Greeks to the surgical tools of Rome, a common thread emerges. Ancient medicine was not a dark age of ignorance. It was an era of profound observation, of trial and error, and of a deep connection to the natural world. These healers were scientists in their own right. They laid the groundwork for so many treatments we rely on today, passing down knowledge that survived for one simple reason: it worked. The next time you take an aspirin or apply a bandage, remember the millennia of wisdom that came before. Thank you for watching. If you found this journey into the past as fascinating as we did, don't forget to like, subscribe, and hit the notification bell for more deep dives into history.